be joined by a guest who is going to help us gain clarity on the subject of depression, who is going to help us know if what we think is depression is really depression, the signs and symptoms, practical steps to navigate depression.
Hello. Hi, sis. Good
Evening.
evening. I'm
Yeah,
sorry. I didn't know you were online already.
okay, it's
Sorry for
fine.
that.
How are you?
I'm fine, but I'm a bit under the weather, so my
Oh
voice
my
will be
God.
somehow,
Oh
but I'll
my
manage.
God. Oh my
I'll manage.
God. It's good to see your face. It's been
I
years.
know. Yes,
How
about
is
five
our
years now.
baby?
So fine, thank you. Thank
And
you.
how is your sister?
She's fine. She will join us
Okay.
soon. Yeah.
Okay, let me address myself very well.
Good to see you
Okay.
again.
Yes, good to see you. So, Nurse Olaide and I we worked in I Foundation
Yes,
for
yes.
yes for some years,
Yeah.
and coincidentally, her sister, her elder sister, and I we went to primary school together, and we attended tutorials together. So we
Yeah.
actually very very good friend, like best friend.
I know.
The first book I wrote, the book was dedicated to her elder
I think
sister.
I even read the book then.
You read the book?
Yeah, I think I did. Yes, yes.
Yeah.
I think
Okay.
it was
Okay.
a copy also. I read the book then.
Okay. So it's like a full circle moment. When I met her in I Foundation, I'm like, it's
Yeah.
like,
I know this
are
face.
you Olade's sister? And she said, yes, I screamed. So it's good to have you. So Nurse Olaide is a registered nurse. She has also bagged a bachelor in science, in bachelor, a degree in how do they say it?
Adult nursing.
Okay, okay.
Yeah.
So how many years of experience do you have now?
Ah, that's about 9 years.
Okay,
Yes. So this year
9
makes
years.
it 9 years since I've been
Yeah.
practicing nursing.
Okay, 9 years of nursing experience. And we are having
Yeah.
a very interesting subject today. We are looking at practical ways or steps to navigate depression. Um, Unfortunately, many people are depressed, but we
Yeah.
only think those that are admitted in the psychiatric hospitals
Mm.
or those that are already roaming naked. Those are the only people with issues upstairs. So my first question would be, what are some myths? What are some things that some people think are actually true about depression that is not true? Some
Okay.
misconceptions about depression.
So from the part of the world that we came from that part of the world, it's always very difficult trying to explain to people that, oh, you're going through depression, or what's happening to me that you people don't seem to understand is depression. And another thing attached to it is it can be bad luck. It is bad luck. And then there's something in, I don't know if you people have it in Igbo land. In Yoruba,
Okay.
they would say if somebody acts in some type of way, like out of character, what they would first say is, are you sure this person is okay? Oh, maybe because the sun is out, that's why this person is behaving this way.
Mm,
Or sometimes they can say, oh, maybe because the sun sets, that's why this person is behaving this way.
I think
Oh,
I've
the
had
moon
that
is
one before.
out. Ehen. So sometimes they can say, oh, maybe because the moon is out, that's why this person is behaving this way. And some
Mm,
even linked it to the lunar calendar. This I came to understand when I was in school and went for psychiatric posting in RO then. So many times people don't understand what depression is. There's so much misconception. People even think you cannot be depressed. How can you be depressed?
mm.
They don't seem to understand it. So it's, well, I would say it's broad. It's not that broad. It's just that there is little to no understanding at all to depression from where we came from.
And some people
And
think,
sometimes another misconception is that it's a form of punishment. Like you've done
okay.
something that is out of line with the gods,
Oh,
so
okay. That's why the
it's to
person
be
is depressed.
punished. So that's a form of punishment for that person. So there are plenty of misconception around depression and even mental health as a whole. So we still have a long way to go when it comes to mental health in our own part of the world.
And some people think young people cannot be depressed. That
Yes.
what have you
What are you
why are you depressed?
thinking?
What have you achieved? How old are you? Why are you depressed? Okay, so help us
So
understand. Okay, you want to say something about what I said?
I was going to say even children as young as 10 years old can be depressed.
Hey, that, oh, oh, okay,
Yes. Yes.
okay.
So depression can affect anybody. It
Mm,
doesn't matter your gender, your race, your status. Anybody can be depressed. Anybody can be depressed. A child can be depressed in their own kind of depression. What they have is called um disruptive mood dysregulation, and
okay.
so they tend to have this form of anger. It's always out of line. Of course, you can get angry, but their own kind of
Mm.
anger is always
They
out
can
of line.
outburst. They are overly
Yes, yes.
reacting.
So yes, so that one is always, out of the line for a young child, and you usually see it from age 10 and above.
Okay.
So it can affect anybody.
Okay.
Anybody.
So, what is depression? Help us understand what depression is.
So, like I said, depression is a mental illness, and it's characterized basically by low moods, severe low
Okay.
moods, and it's always persistent.
Mm,
Also, you are no longer interested in things that used to excite you in the past, like hobbies, activities, and it can be low, mild, moderate to severe. So that's basically what depression is all about. And these symptoms can last about 2 weeks or more, and even up to 2 years. But at least if you've been feeling like this for about 2 weeks, then you should consider depression.
So what are you've mentioned some anyway in your definition,
Yeah.
lack of interest, low mood,
Yeah.
and this is usually persistent. But what are some other things that help us identify, like a
Okay.
checklist that
Yes.
help
Yes.
us
So
know
we
signs
have,
and symptoms that help us know if we are depressed or not, or maybe
yes,
somebody we are living with or somebody we are
we're
working with.
seeing the signs. Yes. So for the signs, we'll say there can be feeling of worthlessness,
Mm,
like why am I like this? You're feeling worthless, you are irritable. There can be appetite problems, such as either you are overeating or you're not eating at all. There can be sleep problems as well, such as insomnia or hypersomnia. So that's you're not sleeping or you oversleep.
mm.
Yes. So you can also be irritable. There can be low level of energy. You don't want to do anything at all. You just want to be in bed. You don't want to talk to anybody. You don't want to be involved in any form of activity at all. So these are signs of depression, and also poor concentration. So if you have anybody feeling like this, you can speak to them and let them know, because they may not know. But if you're able to identify all this and it's lasted for at least 2 weeks, then such persons should consider depression.
Okay, I remember talking to somebody. She had just lost all her money. She did all this investment thing, and
Mm,
and the savings she had for about 3 years, she invested in it. And when it's time for her to get her return, she had that the whole scheme had packed up, and she was depressed. And when she was narrating, because we went to see her, she was narrating her experience, and she said
mm,
um for like 48 hours she was in a spot. She was only standing up to just go eat. In fact, she didn't eat. She was just there, and I was thinking about it. She was at a spot. She was not eating. She was not drinking water. She was just there lying down. She didn't want in darkness. She didn't want to have anything to do with anybody. So these things are real. It happens to
yeah,
people. It
it
happens
does.
to people. And what are some of the things that can trigger depression? Like for
Okay,
this
so
lady I'm talking about, for her, it was
yeah,
the
yeah,
loss of her investment for
yes.
about 3 years.
So there are different things that can actually trigger depression. Just like you said, some life events can trigger it. Bereavement you can trigger it. So if you're bereaved and you don't get to mourn properly, it can actually lead to depression. So if anyone has lost someone around you, please encourage them to, grieve. Take all the time that they need to grieve properly, because if this is not properly done, it can lead to depression. I've seen people who have lost dear people who are really dear to them, and then they are going to work the next day. They mess themselves into work. They just want to forget. It doesn't work. I know it's just the easiest way to forget, but then you are not grieving properly, and this will always take a toll on their mental health on the long run, which is not good. Then also, if there has been divorce,
Okay.
recently divorced, it can also be a problem. Somebody that's used to living with their partner, doing things together, and all of a sudden the relationship has gone apart. So that can also affect one's mental health, except you get the proper support that you need in that hard period. Also, if one has just been diagnosed of a chronic illness or a long-term illness, it can
Mm.
also lead to depression. So somebody has just been diagnosed with, say, arthritis. It comes with chronic pain and all of those things. So that can lead to depression, Parkinsonism. If there
Mm.
is diagnosis of thyroid problems, that can be a trigger for um, depression. Also, in children, if they've had some sort of traumatic experience growing up, it can affect their mental health and lead to depression. Hormonal problems too can lead to depression. So, say somebody is pregnant, it's common. So there can be prenatal depression, so being depressed while pregnant, or
Okay.
postnatal after having the baby. So postpartum depression occurs within 4 weeks of having a baby. So that also can trigger depression.
Okay.
So those are triggers for depression.
So you talked about life altering events, like
Yeah.
for instance, somebody who was living just coming home, you discover the house has been gutted with fire,
Yeah.
then bereavement, loss of a loved ones. I was reading the story of a woman who was she was looking for communal support. She said two
Mm.
weeks after marriage, her husband suddenly passed on, and she can't seem to wrap up. And me, I'm like, 2 weeks. I can't even advise her because I can't even, for you
Yes,
to like
harsh.
advise, you have to
Yeah.
just put yourself in the person's shoe. Imagine what
Yeah.
it is. I even heard of an incident of a woman, is it 24 hours after wedding? So apparently the man was poisoned during their ceremony. I don't know. So 24 hours after he passed on. So imagine that kind of
Yeah.
the
Yes.
weight of such a
Yes.
sudden loss is enough
Yes.
to trigger depression. Then relationship issues, like you mentioned, you put an item, you put always wearing
Yeah.
matching outfits. Everybody knows you on social media. You are giving relationship advice, and
Yeah. And
suddenly
then all of a sudden, one of the pair is leaving. So
so is enough to be even whether you like it or not, something happens.
yeah.
There's mood swing, there is reflection, and if not properly handled, it can lead to depression, traumatic experience, hormonal problem, and diagnosis of a chronic illness. That's very, very true.
Yeah.
Like chronic, like it's happened, an incident happened in Ghana recently. I want to summarize. So a man came into the country, and somehow he had intercourse with a lot of girls, and he recorded. Eventually, he released, and the man in question was HIV positive. So one of the girls in question, when she had the news, she went to check herself and discovered she was positive. She couldn't somehow handle it. She went and committed suicide. So depression is real. It happens every day. So what would you advise? What are some
Okay.
practical things people can do to navigate depression? It's not my network. Uh-oh.
Okay. I think I'm back now.
Okay, call
Okay.
came from your end.
No, I think okay, sorry. I was trying to share the video because I've told people to come and watch instead
Okay,
of
okay,
having to
okay.
discuss with people
Okay,
differently.
okay.
So so things that people can actually do to prevent depression. So there are certain things we can do. Number one is, I'm sure we've all heard it before, sleep. You need healthy sleep pattern.
Mm.
It is very, very important. Even me that I'm talking, I'm guilty. Sleep is very, 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 very important. It's a very important thing. So sleep for at least 7 to 9 hours per day. Get at least 7 to 9 hours of sleep. I know it's hard. Adulthood is very hard. In fact, I was discussing with somebody, I think it was my sister last week, and I was talking about how it's hard being an adult. Don't grow up. It's really hard. There are stuff you want to do. Growing up, I wanted to grow up really fast to be an adult. And now I'll give anything it takes to go back being a baby. Because now you hardly sleep. You are, even when you're sleeping, you are thinking. At this
Yeah.
stage, it now wants to be even in your dream for you to know that you are not even sleeping properly. So it's really hard as adults, but then it's something we should all aim to achieve. 7 to 9 hours of sleep is very important. We need healthy sleep pattern because that's the only time your body gets to rest. That's the time your brain also gets to rest. You're resting your brain, you're sleeping, your body is calm, even your blood pressure is well regulated. Every part of your body is resting at that time. So it's very important. Also, eating healthy. We need to eat healthy. Like I said, adulthood is hard. So most times we are eating on the go. And when you are
Mm.
eating on the go, what do you eat? You eat junks, you eat fast food, you take soda. All these things don't help because most of them contain refined sugar. Refined sugar is not good for your body. They make you, obese. You're not getting the adequate amount of nutrition that you even need from the food. It's either they are high in fats or they are high in processed sugar. So you're not getting anything at the end of the day. So all we need is healthy food. You need healthy food. You need to exercise as well. At least take about 20 minutes. Even if you don't need to do gym subscription before you exercise. You can exercise in
True.
your own corner of the room. You can go out, take a walk. You don't need to run. You can take a walk for 20 minutes. Even in the process of walking, the breeze alone is enough. You are jogging, is okay. So take at least 20 minutes of walk or jog around your neighborhood is very fine. And eating healthy, sleep well, like I said, drink water, take a lot of water.
Hydration, very
Yes,
important.
it's a very important thing. And also always seek support when you can. Always
Mm.
seek support when you can. I know it's very hard. Most of us don't want to be burdened to people. You don't want people to know what you're going through because you don't want them to mock you after. So that's why you need to get somebody you can trust to confide in them. Let them know what you are going through. If you have money issues, let them know. If you have job issues, let people know. Talk to people. Whatever problem you are going through, even if it's addiction problem, let people know so they know how to help you. Keeping problems to yourself will not solve anything. Like they always say,
Mm.
problem shared is half solved. So when you share your problem with people, they know how to come in. If it's money issue, if they would have to contribute money for you, put you on social media, get the help. If it's job, let people come together, referral and all of those things. If it can help you get job, let people do it for you. So try as much as possible to use help when you can. Don't keep problems to yourself because you are not solving anything. You are dumping them, and on the long run, what comes up? Depression. So make use of help when you can. All these things, like I said, will help prevent depression. And if you live in countries where it rarely sun, try to take your vitamin D. Vitamin D
Yes.
is your best friend when you live in countries like that because there is no sun. You're not getting vitamin D from the sun at that time. So you need your vitamin D um capsule
Supplements.
when
Yeah.
you're not getting it. So to supplement for what you're not getting.
Okay, you've mentioned six very vital things to that is ideal for prevention, and even um there are practical steps too you can take while dealing
Yes.
with depression too. But
Yeah.
when because I know there's a point where depression cannot be managed at home. At what point maybe there's somebody that suffered something staying with you, and you know this person dealt with, for instance, a traumatic experience,
Yeah.
and you've managed the person, oh, drink water, try and sleep, and at what point do you know that this thing is not a something that can be dealt with in the house? This person needs to go to the hospital, specialized care like seeing a therapist, or going to the psychiatric. Most people think a psychiatric hospital or seeing a
Mm.
psychiatrist or a psychologist is
Yeah.
somebody's already mad or something. But at one point in depression, should somebody be referred or forced to go and see a specialist?
Okay. So before I go to the question, I also want to correct the misconception people because it's very common. When you tell people, oh, I know this person going to mental health hospital to get
Mm,
treatment, the first thing that comes to their head is, that person is a mad person. No. There are varieties of mental health problems that are being treated in mental health hospital. I'm very sure there are some people who will be shocked that you can get solution to epilepsy in mental health hospital.
true, true.
So hearing that somebody is going to a mental health hospital does not mean that they are going there solely for mental health problem or because they are mad. No. There are varieties of problems that they treat there, nervous system problems and mental health problems are what they treat them. So for what you said, when you start noticing that somebody has changed, like their routine has changed in the last 2 weeks, such as they are keeping to themselves, they rarely talk, they want to remain in one position, maybe in bed or in chair. And while they are doing this, they are not Netflixing and chilling. They are just there, not talking, not moving, not doing anything. Even to
Mm,
go to the toilet is a problem. Or you notice that, so withdrawal as well, they are not talking to
mm,
people, they are
mm.
not going out, especially people who are social butterflies that we see
Yes.
them, they are always outside, and now they don't want to talk, they don't want to go outside, or they are even closing the curtains, they don't want to see sunlight.
Mm,
Please let them get professional help. And even there's also the point of when they get to wanting to self-harm. It's
mm,
also important
mm.
to encourage them to seek help. That has become an emergency at that point. If the emergency line in your country or wherever you reside works, please make use of it. Just call immediately. And if it doesn't work, let them seek help. Let them go see a doctor immediately. If there's need for referral to mental health hospital at that time, they would refer them.
Okay. Thank you very much. This is profound. This is profound because if these things, maybe you should touch on some complications. Okay, what
Yeah,
happens if something is not done immediately? In the course of this conversation, I've
yeah,
itemized, we've talked about some of these things, but if
yeah.
you allow the person is confined, the person is withdrawn, the person makes an attempt to harm themselves,
Yes.
the person is a social butterfly, the person is looking for the next O and bear, the next
Uh-huh.
place
And
we are
now they don't
going
want to
to,
go.
what is the
Mm,
latest movie in the cinema, let's go and watch, and all of a sudden
mm,
the person is not interested. What
yeah.
if something is not done promptly? What are the things that could happen so that we have that in mind? Because sometimes we have a habit of taking things for granted until.
Mhm. Yes, yes. Until the
So
point
what
of
are
no
some
return.
complications that can result or adverse effects?
So for the complication, first one that I'll mention is suicide.
Mm,
And that's the point of no return. Suicide, which is once that one happens, there is no remedy. That's the end. But don't let them get to the point of suicide. So another one is obesity, especially if it affects their appetite and now they are overeating, it will lead to obesity. So you are seeing change of weight in this person, especially if they are the type that would, they are very conscious of their weight and how they live. And now they've suddenly grown, excessively fat. You want to find out what is going on and help them seek the necessary help from a professional. If you also notice that this person is not sleeping or they are
mm,
oversleeping, you also want to find out what is going on. Like, why is this person not sleeping? There may be other cause. There may be other cause from maybe medications or whatever.
yeah.
But you want to rule out depression first. Like, are we sure this person is not depressed? So that's what you want to find out. And if there is depression, please help them sort the necessary help that they need.
Okay. It can also, I think the complications can be the birth of other chronic illnesses. Because, for
Yes.
instance, when somebody is not sleeping for 2 weeks or more, the person gets to that point where they are confused. So they can do something that can harm somebody else or even harm
Yes,
themselves.
yes,
And
because
it
at
can,
that point you can start hallucinating. For somebody that has
yes,
not slept, your brain is
yes.
not in order. So you can start
Mm,
hallucinating because you are seeing things
mm,
that are not there, you're hearing things that are not there, you're
yeah.
seeing, you know, I've seen, like you said, I've seen a case like when I went, in fact, when I was in nursing school, I enjoyed mental health posting a whole lot. In fact, it was as if that was the best
Green
part of
light
my
for you.
postings. Yes, because it was eye-opening, was eye-opening. I was part of people who used to think, oh, if you go to mental health hospitals because the person is mad. But when I
Mm.
got there, I saw the different things that they were doing. So they brought a lady. Then we went to the A&E, and then they brought a lady. She had not slept for I think 3 4 days. And then when she came, she was hallucinating. She would see nurses, call them farmers, see doctors, call them different names. And then sometimes she can tell you, oh, there's somebody on your head speaking to her, and all of those. I'm like, what's going on? And then, and another thing I enjoyed there was the way they do their history taking there. Whatever the person says, they are writing it down. You can see a case note of a patient as high as this because they were
Wow.
taking notes of whatever they are saying and
Everything.
whatever they are doing at that point in time. I remember one of the things she said was, no, her husband said was, she said whenever she wanted to cook, she was seeing faces inside the pots. She was seeing faces of people talking to her inside the pot. She would say the fish she wants to cook was talking. So those are hallucinations, auditory and sight hallucination, which can happen because you've not slept. The brain has not rested, so they are just seeing things that are not even there. So hallucination can happen with depression if
Okay.
it involves not sleeping.
Okay, this is very profound because some people think it's okay. The busy professionals will sleep when we get to heaven. Set of people they think it's okay to go on for days without sleeping. It can cause
Yes, it's
mistakes that
not
are
nice.
very deadly. Even as
Yes.
we health professionals, sometimes that's why medical error is one of
Yeah.
the cause of medical related death
Yes.
because sometimes medical professionals they don't get quality rest and it opens doors for medical errors in the healthcare system
Mhm.
and even those that are not health irrespective of the kind of work you're doing when you don't get
Yeah.
quality sleep you can make costly mistakes that ordinarily when your
You
head
wouldn't
is
think.
everything is in place and you're calm you're well rested you won't make so and then I was talking about chronic illness not sleeping well can open door for hypertension diabetes even things like
Yes.
cancer it can lead to some form of cancer so if you have questions please ask if you have questions please ask then I want to ask you, are there little ways to support? Usually, depression is a state of low. The person is not
Yeah.
interested, like we've already emphasized over and over again in this conversation. Are there little things that we can do if we find somebody who is depressed? Little things we can do
Yes.
for that person to help them snap out.
So first, if you find out that somebody is depressed, you want to listen to them. Let them talk. Let them talk to you and help you understand what they are going through. Because you might think the person is not depressed. The person is depressed and they are not even depressed. So you want to listen to them to find out if they are actually depressed. So when you are listening, you are doing active listening. You are not talking. You want
Okay.
to listen to what they are saying. And then when they talk also, you want to validate what they have said. Oh, I lost my job. I did this. You want to, let them know it happens to people. You are not the only one going through this. It's a phase. It will go. There are ways we can overcome this. So you want to let them know they are not alone. You are there for them. Also, you want to encourage them to seek professional help. You are not a therapist.
Yeah.
So encourage them to seek professional help. So because sometimes they are not willing to seek professional help. If there's a way you can help them get the help, please do. Also, sometimes if you check online, you can see some NGOs that take people pro bono for therapists. So there are therapists that work with them that can take you pro bono. So you can reach out to those ones because I know speaking to a therapist is expensive. It doesn't come cheap. So if you can make use of those kind of NGOs, please do. And if you're in countries where things work, speak to your GP. They can help you get the proper help. Then also, you that you're helping somebody, don't let them dump their problem on you.
Mm.
Because one way or the other, it will affect you. It will affect things we see and hear around us tend to affect us too. So when they are dumping their problems on you, try as much as possible not to ruminate too much on it. Because when you do,
Um,
it tends to have a negative impact on you yourself. So that brings me to creating boundaries. Know when to stop, know when to stop. Like when they bring this, okay, this is the time to seek professional help. Encourage them to seek the professional help and ensure they are using that professional help that they have gotten. You yourself do your self care because they have dumped their problem on you doesn't mean oh we should dwell on it together. No, it's their problem. You're getting help for them, and you yourself, you're not like neglecting yourself. You are also not withdrawing from people and all of that. Go out, do your self-care, do your nails, do your hair, do things that you enjoy, not because they've dumped their problem on you. You are also going into your shell. So those are things we can do and encourage them to exercise. You can do it together. They don't want to go on a walk, encourage them. Let's go together, let's take a walk. Let's go out. The breeze out there is cool. Let's go together. So those are ways you can encourage them. Let them eat if they are not eating. Encourage them to eat food. So food that are rich in omega-3 are very, very good for the brain and helps with mood. Food like salmon fish, mackerel fish, chia seeds. Those food are really good. Encourage them to take it these are things that will help them. So those are ways that you can help people around, either a sibling, a family member, or a friend that's going through depression.
This is a very rich conversation. And
Mm.
sometimes as you were talking about boundaries, it just occurred to me that sometimes if you are not careful, especially with the way the world is now,
Yeah,
you can push yourself into depression by the things you expose yourself
yeah,
to. The news, some people, the pressure there
yes,
was a time I had to follow a popular celebrity because her lifestyle was giving me pressure. Every time I watch her content, I'm feeling inadequate. I'm feeling I'm like, no, I can't do. I just
yeah,
unfollowed her. So you have to. Boundaries are very important, even
yes,
to because if you don't watch it, even though you are not depressed, it can open the door. It can be like a trigger
yeah, trigger,
for
yeah,
depression because you are. Some people are following a certain people that every time they watch them, their chest tightened. They are putting their spouse under pressure. This
yes,
person did
yes,
this for her husband. This person did this for the wife. You can't you do this for me? Can't you do
yes,
this
just
for
because of
me?
what you've
And
seen.
exactly, you put yourself. You are working. You are doing things not because of yourself, but you are doing things to compete with what you are seeing. And some
Yeah,
programs, if you don't like me, I don't have. I will hear somebody's story. I'll be crying. So some kind of stories.
yeah,
You know, there are some shows they do on radio, on TV, or even on social media where people share their story. If you don't have
yes,
filter,
yes. Don't
don't have
watch.
filter, you'll be absorbing the negative energy because when
Yeah,
I was doing a course on cancer, there's what is called vibrational energy. So those things comes with negative energy, and if you're not careful, you absorb, and then you realize that you are now sad on top of somebody
yes,
else's wahala. You are now this person beat this one. You too now,
yeah.
hey, hey,
I
and
heard
you're in
something
your house
like that
crying.
before.
It's
There's a
happening.
guy I follow on social media. So he brings couples living in outside Nigeria, brings
Okay.
their problem, like they share their problem with him, and then he brings it to social media that, oh, this person has said this. It's usually about couples who have come to UK or US and then they're having financial problem, or they don't know how to manage their finances. So we'll come to social media to talk about it, how they are fighting, how they want to divorce, and all of that. In
Mm,
all of this, he has a very good wife. His home is okay, very good. But then later I noticed it wasn't coming out to talk about all those things. It was his content had changed. It was talking about other things, doing other things. And I was wondering what changed. So it was as if he read my mind that day. So the next day he did a video and said people have been coming to his DM to ask him why he has stopped bringing, because in all of those things, after people have shared their advice, people still joke about it, laugh about it, you
mm,
know. And then he said people have been coming to his DM to ask him, oh, why have you not been sharing all these things like you used to? We all learned from it. And he was like, no, I had to stop because at a point he was drawing the negative energy
mm.
from those
Yeah.
stories, and it was beginning to affect his own. So he had stopped. He started feeling good again, and his home went back to normal. So because he's been hearing things, maybe at home he and his wife were doing 50-50 and they were managing it well, but it's gotten to the
Mm.
point of maybe the wife is coming to say, oh, now we are not doing 50-50 again. Oh, you take all the financial
Responsibility.
issues. So I guess that's beginning to happen in their own problem. Maybe there's a way they were managing themselves before, and now because of stories they hear around, take it or leave it, it affects you, like you said.
Yes.
It tends to affect you.
Yes, and all these blogs that carry latest news. Sometimes it's okay. You mustn't be the first person to hear news. Sometimes be the third, like when the news have already
Yes.
been and
Don't be
passed.
the last.
Be the last person because if you are the type every time you go to a certain blog is negative news. There's one accident. There's one fire outbreak. There's one, and every time you get there, it's negative. It's whether you like it or not, it goes in. It goes in.
Yeah.
So sometimes be the thought when the news have sometimes my husband will ask me, did you hear what happened? I'm like, no, I did not hear because I unfollowed some. I realized that when I
Yeah.
was following all these people, it wasn't helping me. So I unfollow. So be quick to my sister, exactly, gossip blog. Guard your heart.
Yeah.
Guard
Yeah.
your heart. Know yourself. Pay attention to your body. When you know that things are
Yeah.
how you know. I think the first rule for everybody is pay attention to your health. Know yourself and be
Yeah.
true to yourself. When you know you cannot deal, be quick. I am very quick to use my unfollow button, my block button. I'm
Yeah,
very, in
me
fact,
too.
I'm like, I hope these people don't have limits because the way I block people. So be quick to set boundaries, protect
Yeah.
your mental health so that you don't get into trouble. I can see that we don't have questions, so I'm just going to, for those who are just joining in, I'm going to summarize what we've learned so far. and then I will allow you maybe give your last word. I don't want this to be more than 1 hour. Okay, I don't want this to be more than 1 hour. So for those that are just joining in, we've had Nurse Olaide, and she's been talking to us about practical steps, practical ways to navigate depression. And depression is a mental state. Is a state where you observe that it's characterized by low energy levels, lack of interest, and it could be low, mild, and in some stages actually severe. One of the key words when it has to do with depression is persistence. Persistent, consistent, a state of low energy levels, mood swing, whatever, and it's continuous. It's not like something that happened in 2 hours and the person snap out of it. 48 hours, 2 weeks, to even 2 years. Okay, and we talked about the signs. How do you know? What are some things that a person is exhibiting, or you find in yourself, and you know that this thing is depression? Worthlessness, loss of appetite or overeating, insomnia, meaning not sleeping for days, or actually oversleeping, oversleeping, low energy levels, no interaction, poor concentration. If you're somebody, especially, it's easy to observe. If you're a social butterfly,
Yes,
it's easy to observe when they are depressed. And we talked about the causes and triggers. We just finished emphasizing one: exposure to all these gossip blog stories of people. If you're not careful, if you don't have a good filter system, it can pull you in. The negative energy can pull you in. Pressure from social media can make you start living a lifestyle. I hear lots of people are in debt because they are trying to live a lifestyle, trying to meet up on a lifestyle that is not theirs. They'll borrow from one loan app to another. Then there are life events. Life events can lead to depression, sudden fire outbreak. There was a lady that she was begging on social media that fire gutted her goods. She was owing lots of people and all. If not properly managed, it can lead to depression, bereavement, loss of loved ones, 2 weeks of marriage and one spouse is gone. All those things can lead to depression. Relationship issues. You've been dating for 5 years. You thought this is the final bus stop. You've gone for introduction, and bros come and say, no, I'm sorry, your color, I don't like it anymore. I want somebody who is dancing. Or you are a pharmacist, I prefer somebody who is a nurse working abroad. And bros say it's over. So things like that, because you've already seen life 20 years, 50 years, is enough to lead to depression. Diagnosis of a chronic illness. Suddenly they are telling you, telling somebody that the person has HIV or cancer, tuberculosis, chronic illness or hypertension, and you're wondering from where to where, how not. So traumatic experience, an accident, an incident, these things can lead to depression. Hormonal problems, problem also. And I was supposed to have a guest, and our topic was supposed to be baby blues versus postpartum depression. This happens to a lot of yes, most women during pregnancy, even before you get pregnant, there's pressure, especially if it takes a while. There's pressure, then in the pregnancy, there's a pressure, and then postpartum. Yes, I was even watching a video the other day how some people during pregnancy they lose their vision, they have hearing loss. Like, you've seen that before. Which one did you see? Hearing loss?
Loss of eye.
Hey,
yes, I've seen that. It was that eye foundation. Yeah, she was pregnant with twins, and then she lost her sight. Although it came back after she had the kids, so but then it wasn't, the 6 vision.
Oh my God, this thing is more serious. So imagine that kind of thing. This like a combination of two of the triggers.
As in, she was pregnant at that time, so when she had the baby, the vision didn't come back.
Oh, oh my God. Oh my.
Imagine she would have prenatal depression and postnatal depression.
Wow.
It's a lot.
So we looked at some of the prevention, quality sleep. If you are having, let me just drop a natural remedy that can help you. If you are dealing with having insomnia, do warm water therapy. Drink lots of warm water. Then the second thing I advise you to do is get chamomile tea. Chamomile tea baths, or you do banana peel tea. Get about banana peel tea. Wash properly, maybe soak the peel with baking soda, a half teaspoon of baking soda, or your sea salt. Soak for a few minutes, wash thoroughly, rinse maybe about 2-3 times, put it in your pot, add about 5 pills to 2 cups of water. Cook under low heat. Once it boils, leave it covered, allow to simmer 2 to 3 hours before your bedtime. Drink about 350 mils. And then when you drink this thing, lie down in the bed. It's not the time you'll be pressing phone or you'll be watching action film, because you are stimulating, your brain is trying to sleep, it's trying to shut down, and you are doing something that's, so it's counterproductive. So when you are, anytime you take anything that they said should help you sleep, please put down your phone, put off the light in bed, and lie down. So this, it will be easier for the whatever you've taken to take effect. Eat healthy. Eat healthy. When you don't eat healthy, it leads to hormonal imbalance, inflammations, minerals are not balanced. The part of the body that's supposed to be acidic is now alkaline. The part that's supposed to be alkaline is not acidic. There's just chaos in the system, and it affects. So eat healthy.
Let me add that you should also know how to manage your stress. Know how to manage your stress. Find your own coping mechanism. So if you are the type that you like to watch movie to help you distress, do that. If you are the type that likes to go out to just appreciate nature, do that. Don't, I know sometimes it's adult life is hard though, but just find a balance. To
Yeah, very
find a balance.
important.
So you have to go out, something to help you, even if it's
Yeah.
yoga. Yes, you can do
Yes.
yoga. Do
Yes.
it in the corner of your house. It doesn't need you to go out, or you can do it in the corner of your room. Just do it. Find your own coping mechanism, something that just helps you. For me, I think is movie.
Yes, me too. Movies.
Do
I
that.
binge on
Yes.
movies. Yes, movies,
Do
music,
that.
loud music. That's better talking drum. I love music a lot.
Yes.
I love
Yes.
music. And for some people, it could be reading fictional books. That one doesn't work for me anymore anyway, because reading is not, it's not a hobby. It's hard work.
It is you're using your brain.
Yes, I don't think it's a hobby to me anymore. It's hard work. But if you are the type, some people actually, reading is a way to relieve anxiety and stress. Not
Yeah.
serious reading. Maybe a fictional book, a story
Yeah.
book. You can read that. Then talking about coping mechanism, dance. Dance. Find love, play music that you like and dance.
Yes.
Dance. And deep breathing exercise. Deep
Mhm.
breathing exercise. If you find yourself in a
Yes.
place and you are all like, take deep
Yeah.
breaths.
Right.
Take it. Take it until you feel calm, until you feel better. You can even do,
Yeah.
some of my clients, I tell them take up to 15 times in a day. Spread it 5 in the morning, 5 in the afternoon, 5 in the evening. It helps with anxiety. It
Yeah.
helps with it even helps you sleep better. Because sometimes when you don't have enough oxygen inside, you cannot sleep. You are
Mhm.
restless. So do deep breathing exercises. Then we talked about hydration. Hydration is very important. Drink lots of water. If it needs you getting a big water bottle, you know that this is my 3 liters bottle for the day.
Yeah.
You keep put it here, you'll be seeing it until you finish. Even get an accountability partner to ensure you are drinking the water you need in a day. Then support, be vulnerable to the right people. It's not the one that you will tell your problem. The next day they are using it on their status as points to educate
Mhm.
other people.
Yes.
Be vulnerable to the right people. Talk to people. Me, I don't know how to, if something is doing me, I'll look for one person and tell. I don't know how to bottle things inside me. So
That's somebody.
ensure
That's the
that,
thing.
yes,
It
you have
doesn't mean you're a
somebody.
strong woman.
Eh?
It doesn't mean you're a strong woman.
Exactly. Exactly. Talk to somebody, even if it is your older sibling or younger sibling or somebody in church. Just look for somebody you know you can trust, that you can tell that,
Yes.
oh, I am losing my mind. I'm losing my mind. And the person will say, oh, where are you? Let me come and meet you there. At least they spend time with you, so that in that process of the chaos, you don't do something that you would regret.
Yes. And you regret later. So
Because
at
it
that point,
just,
they help you.
yes, they are just there with you. They listen to you. They talk to you, and so vitamin D, lack of vitamin D can also trigger
Yes.
depression. Lack of vitamin D. So everybody's now, we are all doing indoors. For most of us, we are now doing content creator, tech
Yes.
bro, working from the house. We don't
Yes.
go out for like one
Yeah.
week, provided we have everything we need, data, food, everything. But sun is important. Vitamin D is important. Somebody, not so strong woman. Help. So you can get the supplements. You can even get it from natural sources. Okay, you can Google natural sources of vitamin D and you incorporate them into your food. Chia seeds, then we talk about food, salmon, chia seed, most of the seeds, they actually help with
Yes.
vitamins, protein, balancing your meals and all. Then we talked about the difference between um when depression should no longer be, oh, let's manage it at home. Okay, she will be fine. It's going to be all right. Oh, let's pray about it. Let's uphold her in prayers. When depression is beyond prayers, supplication, encouragement, when it should be taken to the hospital, when there is confinement, withdrawal, self-harm, the person cuts themselves, you catch them buying sniper, and you know that there is no need for sniper in the house. You see them, they are packing all the drugs, looking for where there's, you see them gather, maybe they have drugs in sachet form and they are bringing everything out and gathering it and putting it in a nylon. Things like that should be a red flag. At that point in time, look for people, even if it means bundling them to the hospital. Because if you don't do that, you might live in regrets. You'll be like, if I had known, I would have done. So we don't want the coulda, woulda, shoulda thing. Like, yes. So we don't want that. We should take them to the hospital. It's better you take them to the hospital and so okay, this thing is not a big deal, and they leave them with a few drugs than for you to not do anything and then you come and find them lifeless one day. I pray that it won't happen to any of us. And we talked about the complications, suicide, obesity, chronic illness, and then we talked about practical steps to support. Listen, somebody in the group mentioned empathy. Okay, be empathic. I'm trying to think of how to define empathy.
Put yourself, or put yourself in their shoes.
Yes,
Put
yes.
yourself in their shoes.
Yes, don't be like saying, "Oh, is it that small thing that happened to you?" I beg, move on. Everybody, they break our hearts. Don't just because you have a thicker skin. Some people they don't they can't just chest a relationship issue like that. Everybody is different. So put yourself, even if you don't understand the whole thing, and you're like, this guy was maltreating you. Why are you behaving? Just listen to them. Just be there for them. Simple. That's not the time to start giving advice.
Listening to all their stories, and at the end of the day, don't have anything to say. Just support them, hold their hands. That period is very
Validate them.
important. Validate them. Oh yes, you're not the only one. You don't have to talk. You don't have to advise.
Yes.
Listen to them. Give them a hug.
Yes.
It shocks the amount of things your hug can solve. So just give them a hug. Just hug them at that time. It's very important.
Very, very important. And then we talked about boundaries. Great, as you are helping somebody else, be careful so that you don't lose yourself while trying to help somebody. Is tough. It's tough. I know somebody, she said she stopped counseling because it was taking a toll on her. So she stopped counseling, because she was absorbing everything. So create boundaries, protect yourself so that you don't get swallowed up in whatever they are dealing with. Very, very important. So since there are no questions, I don't want this to be more than 1 hour. I want to about an hour. I want to thank you, Stis, for joining this session, in spite of everything, in spite of your health. Thank you so much. And it's value packed, very, very packed. I've learned a lot myself. And as you can see, I took notes. Because I wanted to, yes, I wanted to. So next time somebody's asking me about depression, I'll just go and bring my notes.
It's something that is very common these days.
Very common.
It affects more of women than men. So it's something really common, very common. So we need to. It's a very hard conversation, but we must have it.
Yes. And I think you should. I think there was a time. I don't know if it's you. I don't know if you are the one. I don't know. Maybe it's you or Noshola. That we were saying something, and somebody said she wanted to go and do. If she was to specialize, she was going to do a course, psychology or something. You are the one, right? I think
always loved mental health.
You've always loved it, yeah. So it's interesting. Me too. I find it very interesting, but I don't know yet. I don't know. But
I'm still thinking about it. I'm thinking of doing something in mental health because it's something I enjoy. It's
Okay.
very fascinating. I love it.
Yes, yes,
Mhm.
it is. It is. Thank you so much for your time.
Thanks
Thank
for
you so
having me. I
much.
don't mind coming back some other time, but I really enjoyed this.
I trust me, I'll take advantage of it because sometimes I don't want to come here and talk, and some of these people are used to me, so they don't really rate me like that. So I like to bring other people, and sometimes
Yeah.
when other health professional, when we join voices, it helps people know that these things we
Yeah.
are saying is actually true. Because we have like the example you gave about the pregnant woman who lost. Imagine how many people, how many even me myself, until I watched that video, I didn't know that pregnancy could make you lose vision, suffer hearing loss. I
Yeah.
thought it was just okay, your shape would change. I didn't know it's there are severe effects of pregnancy. Most people take these things for granted, but when you have knowledge, it helps you. It helps you to protect yourself. It helps you to advise somebody. Like if that woman was not maybe educated or she didn't have the right people, she would have been going from one spiritual house to
Yeah.
another
Yes.
and doing
Can
all manner
imagine.
of things that would have maybe complicate her vision. Maybe they would be putting stuff in her eyes, not knowing it was
Yes.
pregnancy induced
Yeah.
vision loss. So knowledge is very important. And I'm happy that you look at all the things you've told us about depression now. At least everyone on this live section, when we come face to face with depression, we are at least we know about three things we can do, three
Yeah.
things we can look out for, three ways to help, and it goes a long way because most things that the things that have put people in trouble is doing the wrong things,
Yeah.
believing myths, doing the wrong things instead of doing the right things. And I pray that God will help all of us in Jesus' name.
Amen.
Thank you so much, Nurse
Thanks for
Olaide.
having me,
Thank
sis.
you so
Thank
much.
you.
All right. Bye-bye.
All
Bye,
right.
everybody.
Bye.
Bye,
Yeah.
everybody. Bye,
Bye.
everybody. Thank you for joining in on this live session. Thank you so much. I hope you got value. I hope you got value. If you have, I'm going to, when I'm posting this video, I'm going to also tag Nurse Olaide. So if you have questions about depression, whether you're watching the replay again, you can always drop your question and either myself or Nurse Olaide will answer. Thank you so much for your time. Bye-bye. Bye.